Have you ever been driving your car? Maybe it's 15 miles per hour, maybe it's 25 miles per hour, maybe even 50. And all of a sudden you get hit from behind and your neck goes way far forward and way far back and hits the headrest. Let's say you were playing football and you got hit, or you were playing basketball or tennis, any other sport, and you fall and your head goes back, it comes forward. Well, that's whiplash. And the funny thing about whiplash is most of the time it doesn't hurt right away. Your body is still in shock from the trauma. And what I see the most in my office is a couple of days later, they'll come in and excruciating pain in the neck, or things like muscle spasms. The neck just is not moving the right way. One side is really tight. It might be the back, it might be the front, it might be left or right. These are all signs and symptoms of whiplash. And whiplash can be a very, very, very dangerous injury depending on what gets injured and how much force or momentum there is. I'm Dr. Cole with Mid-Atlantic Chiropractic. I'm going to go over a couple of unique details when it comes to whiplash. I'm going to show you, starting on out, what a normal cervical spine should look like. Ideally, we should have this front-facing curve known as a cervical lordosis. What happens to the cervical lordosis when you're in a whiplash injury? The first thing across the board that happens is these lower cervical vertebrae, C6, 7, sometimes C5, they go into extension. So think about them coming straight up like this. And when that happens, the upper cervical vertebrae go into flexion very rapidly. And one thing I want you guys to take note of is look at the spinal cord when we go into rapid flexion. That spinal cord goes on stretch. And so what happens? The spinal cord ideally should be relaxed. It should be loose. It should be like the palm of my hand here, nice and soft. And when our neck comes super, super far forward, you see what happens to the palm of my hand? It becomes stretched and tightened out. That not only puts pressure on the spinal cord, but also the nerves that are exiting. In addition to that, during a whiplash injury, what happens is all the ligaments of the neck often become stretched. So in the front of the neck, we have something known as the ALL, or anterior longitudinal ligament. In the back of the neck, we have something known as the posterior longitudinal ligament. Between each one of these spinous processes, these little dinosaur bones here, we have interspinous ligaments. Now, there are a lot more ligaments in the neck. I'm not going to go over all of them, but those are the ones that are most commonly impacted. A lot of the times, what happens after an injury like this is you'll go to the hospital, the emergency room, or the doctor, and what they'll do is they'll take an x-ray. A lot of the times in less severe whiplash injuries, nothing shows up on the x-ray. And if they don't follow up with an MRI, they don't know if there's any soft tissue damage. And so the key takeaway from this is in most whiplash injuries, it is soft tissue that becomes damaged. And so what happens if that soft tissue is damaged and nothing is done about it? Like I said before, we should have a nice cervical lordosis. When we have that rapid extension and flexion of the upper cervical spine here, we develop what's known as a kyphosis, which is this curvature here, this rear-facing curvature. Now, the neck stays in this position for a long period of time. Oftentimes we see it or call it text neck. This is when the person's shoulders are rounded forward, the neck comes out, the forward head carriage increases. This puts a lot of strain on not only the trapezius, but the muscles of the suboccipitals here. So the rectus capitis, posterior and minor. Signs and symptoms: headaches, migraines, tension headaches, tinnitus, ringing in the ears, all sorts of nasty things. And so what we do is we take an x-ray of the neck. First things first is we take a look at the curvature. We want to make sure you have that lordosis. A lot of the times, if it's years and years and years after the injury, we'll actually see that the person still has a kyphosis in their neck. And what happened was this anterior longitudinal ligament, it was stretched out super, super tight and never had time to heal. It didn't go through a proper range of motion, and now we're stuck like this. This is when we implement tools like the Dental. It's a foam wedge that you'll lay on for about 10 minutes per day. That's going to help restore the natural cervical lordosis in your neck. And so one thing that everyone should know about whiplash is that yes, you should have your neck evaluated. Yes, it is normal to feel sore multiple days after the injury. And yes, you should do something about it long term in order to prevent further degeneration. The front of the spine is very fragile. We have discs there. We want to make sure that the weight is being bared on the posterior elements of the spine as well as the spinous processes. If you have a whiplash injury, if you fall, if you're playing sports, if something goes on in your neck, it's always important to have it evaluated. I'm Dr. Cole with Mid-Atlantic Chiropractic, and we look forward to seeing you next time. Thank you.